Welcome, everybody, to Circle Back to You. I'm your host, Jason Wilson. Today, we have Kelly Price and Michael Louwers from Reset Medical and Wellness Center. Welcome to the show.
Thank you, Jason.
Thank you for having me.
Sure, it's an honor. It's a pleasure. This comes at the perfect time for our upcoming Oncology Mindfulness Freedom Fight Expo. We're so excited to have you as speakers, and today is going to give a lot of insight on what you guys actually do at the center. So thank you for being here.
Thank you.
Of course, absolutely.
Kelly, we're so honored to have you. How did this idea start, and when did you get started with the center?
Well, thank you so much for having us. First of all, it's a great honor, and you're doing such great work, so we appreciate you. Um, I actually got started in it by a fluke. I'm not a doctor, but I am super passionate about helping people to overcome tragedy and trauma and different things. And so, for many years since 2018, I started a foundation that helps people in catastrophic circumstances. Financially, though. So, if you had a house fire or a traumatic injury or accident, and you needed a one-time financial grant to get you to the other side, I was helping with that. And I was doing some other mission type work along with being involved in some social action awareness films. And as I was doing that, one of the producers that I work with was following a doctor that was treating military and other individuals for PTSD, anxiety and depression, menopause, long COVID. And when I found out about it, I said, not only do I want to be involved in the documentary that they're doing, I really want to understand what this treatment is about because my son's a fireman. And I know that he was struggling very much with post-traumatic stress and struggling to sleep, a little bit of, not a little bit of depression, anxiety. And so immediately, as soon as I found out about it, I was like, not only do I want to be involved, I want to get him in for treatment. Got on the phone with the doctor right away, took him in for treatment a couple weeks later. And by the time I had gotten there, I had talked to several people that the producer had worked with that had had the treatment. And I knew that I not only wanted to get my son the treatment, he hadn't even had it yet, but I was going to open a center in Cleveland. So I walked in literally and introduced myself and I said, I'm Kelly Price and I want to open a center like this in Cleveland. And so the doctor's like, okay, like not many people probably do that aren't doctors. But really, once I saw the profound results that my son-in-law had, myself, I had the treatment done for menopause. I was struggling immensely with menopause, 35 to 40 hot flashes a day. And then I had a friend that had been in, there's a fight and a flight, and then there's a freeze where you have no emotion and you don't have, you don't have, you're so overwhelmed with anxiety and depression that you don't have the ability to cry or to laugh anymore. And as soon as I found out about it, I said, you've got to go. Like I had been through treatment centers with her and helped her through a lot of different things. And her and I went together and to see the reaction and to see her actually have tears like right on the table saying, I can feel like the straight jacket was removed and she had emotion and she's like, I can actually feel the love that my daughters and my husband has for me. So I had already made a decision to open a center. What I learned very quickly is you actually can't open a medical center if you're not a doctor. So that was a little bit of a kink in my plan, but this was January 8th and 9th. And so I set out to find a doctor that would see the vision that I had. And I was referred by another doctor in the area to Dr. Joshua Goldner. I shared my vision with him, and within 72 hours, we had never met in person. He said, I'm in. What do we need to do? And started on a business plan at the end of basically the end of January. I had already secured the space that I was going to rent. I already had started like a whole plan of who was going to be working for us, that type of thing. And we literally put together a team, ordered all of the equipment, got everything ready, did it all by Zoom because prior to this, learning about this, I had already had something scheduled out of the country for the entire month of February. I was running some retreats. So I like was working on opening this business at the same time while I was running these retreats, while I was out of town. And Dr. Goldner and I spent every single morning for like 3 or 4 hours on Zoom before everybody would get up. I'd get up at like 4:30 or 5 in the morning and we'd start and we would work to get this plan together. And then on March 9th, we came back together. We all got together at the office with all the employees that had been hired and sat down and did a strategy meeting. And that was the first time we'd all met in person. And then Dr. Louwers, that was all great, other than Dr. Goldner has a job at the VA. And so he couldn't be our practicing physician. So we didn't have a doctor, but we were set to open April 4th. And Dr. Louwers joined our team late March, but had another job. So we had to wait for him to transition out. So it was just kind of crazy. But anyway, we opened our doors on April 4th when saw our first patient. So less than 90 days later, we were up and rolling and treating patients. We had our grand opening June 1st, and it's been just amazing. Dr. Louwers has been on staff since May 1st, full time, and has just been an incredible blessing to us.
Wow, that is an amazing story. I mean, you guys did all of this within a matter of months. I mean, that's unheard of. I know that God is involved in this, and I'm so glad to be partnered with you guys and to be a part of it. Michael, how did you meet Kelly, and what exactly do you practice, and what do you do at the Reset Center?
Yeah, so my background is in interventional pain management, the same as Dr. Josh Goldner, and that's how I knew Dr. Goldner. And he had approached me and along with Kelly back in March and said, hey, we have this possible job. And at the time, I was looking to transition out of the practice I was in. It was a very hectic practice and very stressful environment. And so I was transitioning out and looking at some major hospital systems like the Cleveland Clinic and the University Hospital System here in Cleveland. But knowing Dr. Goldner, and he's an excellent physician and a good colleague and friend, he said, this is a really good opportunity. And so I said, okay, well, let me think about it. I'll look into it. And so I did some of my own research and literature review and looked a bit more into this and said, wow, this is really, something interesting. This has some real potential. And and with a little bit of a leap of faith, I took a chance, and it has been just unbelievable since that time. I mean, it's a remarkable things that we're doing here. Seeing these patients, as Kelly mentioned, often turning around right there in front of you from completely blocked to, emotional and laughing or crying or just, healing is something that I hadn't really experienced. A lot of medical professions, they don't get that chance, right? I mean, you give someone a medication and maybe a month later you see a little bit of improvement and then you try something else. This is really groundbreaking in that it is it's directly treating an injury and turning patients around and giving them a opportunity for a real lifestyle change and a real improvement in their mental health. And so that's, at this point, I'm completely sold. It's really been great, but that's how I got involved. And the procedure itself, we can talk more about it, but it's something that I had done in my own practice because it is used historically to treat pain. We've modified the approach slightly, but essentially it's a 100-year-old treatment to manage a certain type of nerve pain. And now we've found and discovered that there's other uses, like Kelly mentioned, a number of uses that previously we hadn't known about. And personally, I hadn't really known about until 6 months ago. And I had really started to look into how this treatment can affect more than just pain.
Along the lines of the procedure, how long does it take, and what kind of clients do you see?
So our primary client base is going to be patients with anxiety disorders, PTSD, depressive disorders. Although there are potential benefits for other mental illness, those are kind of the primary patients. In addition, as Kelly mentioned, we're treating patients with menopause symptoms, long COVID, loss of smell, chronic fatigue. It's been shown effective in all those conditions. And so that's the majority of the patients that we're treating. The block itself, to get more into that, it's a very simple block. Like I said, it's been done for 100 years. The block itself, we do using ultrasound guidance. The block takes about 10 minutes. The patients tolerate it well. It's very simple, relatively easy to do, and very safe procedure. And like I said, they're seeing turnaround right away. We do have to treat both sides. So we treat one side one day and then come back on the other side on a subsequent day. But it's very, very simple and often very effective.
That's great. Do the clients sign up for like a series of treatments, or is it just one time? How does that work?
Yeah, so it varies. Um, Often it is just a kind of one and done procedure. Like I mentioned earlier, this isn't intended to be a standalone treatment. It's a treatment that's intended to complement other mind-body healthcare, right? So it's intended to be an adjunct to talk therapy and medication and mindfulness and other types of mental health healing. But this is kind of we often describe it as opening the door so they can use those tools far more effectively. And often in those patients, if they can, they may not need this again. Now, that's not always the case. And frankly, there haven't been long-term enough studies to see the effect out 5 years or 10 years. But we have seen patients that are lasting more than 6 months, more than a year. And we don't know exactly who fits that picture. There are patients we know that re-experience trauma though, right? First responders, military, like you were mentioning earlier, those types of patients may be going right back out into traumatic experience and sort of reactivate that fight or flight mechanism that then triggers their anxiety or PTSD.
Okay, thank you so much for answering that. I know that that's a resounding question for everybody that has heard about you guys. Now, how can everybody find you?
So the easiest way to find us is our website, which is theresetcenter.com. If you go to our website, it has all the information about what we do, the services we provide, as well as testimonials from our patients. And most importantly, it has a free online assessment. So you can take this assessment. You'll be given a series of questionnaires to fill out and essentially track your mental health using an online tracker. And so you can, even if you're not having the procedure done, use this just like you would a physical health tracker to record, how you're doing over weeks or months to see if, your mental health is improving or declining, and maybe reconsider if this is something for you.
So thank you so much again, Michael and Kelly, for being on the show. You will be at our Oncology Mindfulness Freedom Fight Expo on August the 10th, ladies and gentlemen. Go to our website, sign up, and you will meet Michael and Kelly there. Thank you so much again. Take care.
We appreciate you.
Thank you.